Welcome to This Explainer. Today, we're diving straight into the fascinating and sometimes excruciating anatomical journey of spinal injuries. But we're also going to uncover a really surprising twist about the economics of healthcare. We usually think of healing in purely physical terms, like resting up, doing physical therapy, maybe even getting surgery. But right now, we're exploring the totally unexpected intersection of your spine and your wallet. So let's jump right into this agonizing dilemma that affects, honestly, millions of us. From heavy manual laborers to everyday desk workers, spinal pain is just this universal human experience. And when a part of your spine slips out of place, the most agonizing question you face isn't just how to fix it. It's actually, how long should you wait before going under the knife? Do you just tough it out and hope biology does its job? Or do you take immediate surgical action?
Section 1. The Anatomy of Pain.
To really grasp the medical decisions behind all this, we first need to meet the main villain of our story, which is the herniated disc. By definition, this is a localized displacement of disc material beyond the normal margins of the intervertebral space. Basically, think of it like a jelly donut being squeezed way, way too hard until the filling just bursts right out of its safe zone. And the real nightmare? That begins when this displaced material hits a nerve root.
Now, this attack actually happens in two completely distinct ways. First up, there's mechanical compression. That's the physical squishing of the nerve that cuts off blood flow, a condition known as ischemia. But there's also a highly sensitizing chemical cascade. That displaced material from your disc acts like a toxic chemical spill in your body. It releases these aggressive inflammatory agents with really intimidating names, like TNF-alpha and interleukin-6, so your nerve is essentially being physically crushed and chemically burned at the exact same time. Yikes, right?
Section 2. Neck pain and waiting.
Starting at the very top of the spine, cervical disc herniations typically peak when folks hit their 60s. But aside from natural aging, there are specific lifestyle hazards that heavily influence your risk here. We already know about being male, smoking, and heavy lifting. But look at the risk of operating vibrating equipment. If your job involves handling a jackhammer or driving heavy commercial vehicles, that constant, relentless microtrauma significantly elevates your risk for a blowout in your neck. And here is where time becomes a major character in our story. For most patients, the human body is just incredibly good at healing itself. Substantial symptom improvement usually happens within 4 to 6 months, with a complete recovery spanning anywhere up to 3 years. Because this natural history is so favorable, surgeons will generally mandate a strict 6-month waiting period of non-operative care before they even consider putting you under the knife. But of course, there's a breaking point. Take the case of a 38-year-old semi-professional cyclist. For 9 months, he experienced progressive arm weakness and an unsteady gait. Time was definitely no longer on his side. His condition actually deteriorated to the point of requiring an anterior cervical discectomy infusion at the C5-6 and C6-7 levels. When neurological deficits become progressive like that, that standard waiting period goes straight out the window.
Section 3. The rare thoracic disc.
Moving down to the mid-back, we encounter a totally different beast entirely, the thoracic disc herniation. This area of the spine plays by its own set of rules. Symptomatic cases here are incredibly rare, affecting as few as 1 in a million people. That makes up just a tiny, tiny fraction of all spinal issues. And when they do happen, they usually strike lower down in the mid-back, right below the T7, T8 disc. When they do occur, though, they can be absolutely terrifying. Imagine a giant calcified herniation occupying over 40% of your spinal canal. The thoracic spinal cord is already sitting in a super tight space and is poorly vascularized, which basically means it doesn't get a lot of blood flow to help it heal. So a massive hardened mass like this puts the fragile spinal cord in extreme danger. Because these thoracic masses frequently calcify and risk penetrating deeper into the spinal cord lining, surgeons absolutely do not wait around. They'll often recommend a preemptive surgical strike even before any real symptoms appear. Why? Well, because up to 97% of these giant calcified discs lead to myelopathy, and that is severe, often completely irreversible spinal cord compression. Section 4. Lumbar discs and sciatica. Moving further down to the lower back, we hit the most common battleground for back pain, the lumbar spine. Here, the clinical rules get super blurry, and the debates among doctors are just intense. Lumbar herniations affect up to 5% of the population annually, causing that classic intense sciatica shooting all the way down your leg. Now, unless there's a massive red flag like cauda equina syndrome, where severe nerve compression actually threatens your bowel and bladder control, the baseline medical advice is to endure 6 full weeks of conservative care. We're talking rest, physical therapy, and medication.
But what happens when those weeks turn into agonizing months? Massive trials like the Maine Lumbar Spine Study and the SPORT trial show highly conflicting early data. Do you opt for surgery or just stay the course with physical therapy? Honestly, it's really hard for doctors to say definitively because patients in these studies frequently cross over between treatment groups out of sheer frustration. That makes the clinical picture incredibly messy to decipher.
Section 5. The cost of waiting. And this brings us to a major paradigm shift for this explainer. We're stepping out of the anatomy lab and right into the fascinating, highly calculated world of health economics. A recent data-driven trial decided to tackle this messy middle ground of lower back pain. Researchers looked specifically at patients who had been suffering from chronic sciatica for 4 to 12 months. The goal wasn't just to see which clinical path worked better physically, but to figure out which path actually makes economic sense for everyone involved. When you break down those bottom-line financials, a really fascinating picture emerges. Early surgery, specifically a procedure called a microdiscectomy, does have a higher upfront cost of 4,118 Canadian dollars. But it results in measurably better quality-adjusted life years, or QALIs for short. Early surgery yields 1.48 QALIs versus 1.30 for non-operative care. Simply put, you are paying a bit more upfront, but you're buying a significantly better health outcome over a 2-year period. Which leads us to the true price tag reveal, the incremental cost-utility ratio. Now, in the world of health economics, this number tells you exactly how much extra cash it costs to gain one perfect year of health. In this scenario, gaining that flawless, pain-free year of health through early surgery costs an additional 5,822 Canadian dollars.
To put that number into context for you, roughly $5,800 is vastly below the $50,000 willingness to pay threshold that is universally accepted by single-payer healthcare systems. It is essentially a total medical bargain. Because of this, when researchers run the numbers through thousands of computer simulations, they find a staggering 99% likelihood that early surgery is the more cost-effective choice for chronic lumbar pain. No way around it, the math just makes sense. It leaves us with a pretty provocative new way to look at healthcare, and maybe even our own bodies. If early surgery buys a better quality of life for far less than the threshold of acceptable medical cost, at what point does toughing it out become too expensive? Sometimes waiting for the body to heal itself isn't just physically agonizing, it's practically and economically inefficient. Thank you so much for joining me for this explainer, and I really hope this data empowers you to look at your own health choices in a completely new light. Catch you next time.